Joining us now, the Speaker of the House, Democratic Congresswoman Nancy Pelosi of California. Madam Speaker, we thank you so much for being with us on Morning Joe this morning. I'll start by asking you, there have been so many questions about the president's leadership through this crisis, his lack of action. If you could speak to him directly, what do you wish he would be doing now that he is not doing?
First, let me just join you in mourning the loss of so many lives and the prospect of more to come. We all come to this discussion with very heavy hearts about what we can do to prevent more of a spread of this. And so to the president, I would join those, whether it's the governors, the mayors, people across the country who are saying we need the equipment, the personal protective equipment for the workers, the ventilators and other equipment for the patients. We need proper testing. So I would say to the president, immediately implement the Defense Production Act, insisting that businesses in our country turn to producing the equipment that we need. The American people, their representatives, officialdom, all the rest are united in that recognition of that need. It will save lives. We're asking people to risk their lives to save other lives. We're asking people to make judgments about who gets a ventilator or not. That should not be happening. One thing that we could do, that we all agree on, Democrats and Republicans alike, PPE, personal protection equipment, as well as the equipment to save the patient's lives. And again, proper testing. That's been a problem since the start, that we haven't had the proper testing.
And Madam Speaker, when you ask the president, why don't you invoke and utilize the Defense Production Act, he says he is doing it. Is there more he could be doing to actually trigger it, to streamline the process, to get testing to the people quicker?
Yes, he has discreetly, just in a discreet way, done something about ventilators, but there's an overall appeal for him to do much more. And this is nothing that can be handled piecemeal. It has to be across the board. Again, this isn't partisan in any way. Two of the things the American people are concerned about is the personal protective equipment for our workers, the equipment to save the lives of our patients. So equipment, and that act can help with that. And then the other is how we, again, try to address the livelihood issues, the lives and the livelihood of the American people. And I'm hoping that the administration will move quickly to disperse the opportunities, the benefits that are in the legislation we just passed in a very strong bipartisan way.
Madam Speaker, it's been frustrating to see the lives of millions of Americans in the hands of one person, one man who up until the past few days was not taking the advice of his doctors and his scientists seriously. Is there something that the House can do? Is there something that the legislative branch can do that it may not be doing right now? Because it's just so frustrating to think that in this wonderful government we have with separation of powers, that one man can literally hold us to his will on whether he's going to follow science or whether he's going to be listening to economic advisors who have basically told him, well, people have to die. Let's reopen the economy.
Well, let me just say that I'm very proud that we passed 3 bills in a very strong bipartisan way. First bill a few weeks ago was about testing, recognizing that you can't get a handle on the challenge unless you take inventory, unless you know what the challenge is and how it is distributed around the country. Second bill was about mask equipment, so that recognizing we didn't have enough. And again, all of this with strong investments in research for a cure, hopefully, a vaccine taking more time. So, and then our third bill. So let me put it in this way. First, we had emergency. The first 2 bills addressed the emergency that we saw. A second bill the third bill, the second phase, was about mitigation. Mitigation for the loss in our economy, also in some setbacks that we had in addressing the virus, the challenge of the virus. This third bill fourth bill, but third phase, will be about recovery. Again, always addressing the emergency and mitigation aspects of it, but to talk about how we go forward, and in a way that is specific to the coronavirus. I want to be very specific because I hear people saying they're doing this wish list, and that isn't so. We have agreed in our negotiations that everything that we're doing is specific to the coronavirus challenge, and that would be to do infrastructure for water systems. They're so essential. Broadband, because so many people are relying on telecommunication and social media and the rest, and other aspects of infrastructure that will help get us through all of this as we proceed with, again, issues that relate to surface transportation and the rest. But I do think that we've acted in a bipartisan way every step of the way, and we will continue to do so. We may have our differences, but we have to find our common ground. I can't really speak to the nature of the president. I wish that the scientists had been more public about their recommendations. When did they tell the president? Was it 2 months ago? What did he know and when did he know it? But you know what? Right now, we just have to focus on getting the job done. And the comments that I have made recently were based on conversations I had with scientists that if we don't go on a different course of action, we will have more deaths. I'm glad that the president has finally heeded, I guess, the numbers, one set of numbers or another, whatever they may be, may have had him heed the guidance of the scientists. Long overdue. But nonetheless, let's go forward with that and hope that I mean, like yesterday, yesterday with the governors, my understanding is that he said testing. I've never heard there's a problem with testing. Well, how could that be? But nonetheless, we just have to compensate for that without spending too much time worrying about it. In an after-action review, we can review that. And I was interested to hear Dr. Fauci this morning reportedly saying when we get the second wave, if we get the second wave, we can have lessons learned and perhaps some therapies, whether a cure or vaccine. I hope that those lessons learned will be something that we can clearly recognize and deal with. But for now, let's just work together to get that equipment, to get those the checks, I hope, electronically out to people so that some of their anxiety is relieved. Imagine being concerned about being sick and just not even having any resources to address your family's needs. We have important work to do. Again, 3 bills, strongly bipartisan. I'm proud of that, and what we do next will be bipartisan as well.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.